Welcome to the CANS New York monthly Lunch and Learn webinar series. This month, our topic is working together, engaging the interdisciplinary team on collaborative assessment. This Lunch and Learn presentation is designed for care managers and supervisors who have experience with the health home care management process, as well as the CANS New York. And we're looking to enhance skills for accurately and efficiently completing the CANS New York. Today, we're going to explore effective ways to collaborate with the interdisciplinary team, or IDT, as we like to call it, in the completion of the CANS assessment. And we'll be reviewing some strategies for consensus building and conflict resolution. And just a little bit about the Institute. The CANS New York Technical Assistance Institute is a collaboration between DOH, 4 statewide agencies, and the PRAID Foundation. The Institute is designed to provide technical support to CANS users throughout the state, and this support includes the CANS New York introductory trainings, supplemental trainings like this one, as well as coaching support for CANS users. Right, so if anyone is not in the right place, you can chat, speak up, and we'll see. As long as everybody is here and ready to go, get started. So my name is Mary Nichols. I am a regional lead for the CANS Institute for the Hudson Valley region. I'm here today with my co-trainer, Sarah Kane, who is also a regional lead. And we have both been training on the CANS for a while now. I've been using the CANS for say 11, maybe 12 years now in different ways. I've also worked with teams a lot. I love working with teams. I love working with other providers. It's one of my favorite things to do in this industry. And you know, I'm hoping that today that we'll get to talk about some useful strategies and techniques for you all to be working with teams as care managers or supervisors, or in whatever way you plan to do so. Sarah, why don't you introduce yourself?
Good afternoon, everybody. My name is Sarah Kane. I am a trainer at the SATU Training Department at Northern Rivers. I am also one of the regional leads for the CANS New York Technical Assistance Institute. So I am the lead for the Capital District region. So if you happen to find yourself in the Albany area or north of there, you'll probably fall into my region. My background with the CANS, I spent about 5 years completing the CANS as a clinician with kids and families and some of those folks that are part of that interdisciplinary team. And then following those 5 years, I ended up switching over into a role where I was helping to coach some folks on completing the CANS. And now I'm in that role of that lead for that region. And so still continuing to do a lot of that coaching and a lot of this type of, you know, technical reach out and training as well. So glad to be with you here today. And Mary, I'll hand it right back over.
I was just talking about tech coaching there while muted. That's funny. So if anyone has any questions today about either the content or any technology issues throughout any of the training, please feel free to ask your question in the chat box or unmute yourself and we'll respond to you. And so just interrupt at any time. We hope this is an interactive experience. I believe we're going to do a little bit of small group work later. It's going to be a good time, good lunch hour. Right? All right, so I'll get into the learning objectives we have that we've established to guide our presentation. After today's webinar, we hope that you all are able to identify who makes up the IDT. So that would be which providers, the family, the youth, you know, anyone that would make up that IDT, and explain how and why we collaborate with the IDT, other than it just being a requirement, you know, of being a health home care manager, like what is the usefulness of it. And additionally, we'll have an opportunity to look at strategies for building consensus among the members of the IDT and strategize potential ways to resolve conflicts. Does anybody here have any goals that that you have for yourself for participating in today's Lunch and Learn? I guess you're all right with our goals then. Very good. Okay, Sarah, why don't you kick us off?
All right. So I actually want to start this today with a question for you all. So you decided to take this training. It has to do with completing this assessment, utilizing that interdisciplinary team. So my question for you all, if you want to jump into the chat box or unmute yourselves, is why do we want to do this assessment as a team? Why not just sit down and do this by yourself? You're the one who's certified in the CANs, right? You've got a lot of knowledge on that kid. Why is it we want to do this as part of a team? So again, feel free to jump into the chat box or unmute yourselves. All right, and Angela, starting the conversation off for us. Thank you so much. So as you said, it's more appropriate with input from all parties. Rachel added, we need all the pieces to the puzzle. I like that sort of an imagery that you're giving there so that this can be person-centered. Carolyn jumped in as well. Others might have different knowledge or perspectives, and I think that's a really, really excellent point. No one of us has the complete picture of what is going on, except for maybe the child themselves, right? No one of us really has that full picture of what is going on. And so each of us is going to see a little bit of a different snapshot. And so being able to bring those different perspectives to the table, that additional knowledge, really important. Catherine added, all of our resources should be utilized. Absolutely. If we've got access to information, why not make use of it? And then families give different information to different team members. Another really, really great point from Elena. Just because somebody told me something does not mean they're reporting the same thing to somebody else. That could depend on the relationship that I have with that person. So bringing in multiple points of information and knowledge, you guys already know this as CANS users, right? This is really, really important that we do that. So thank you guys for jumping into that conversation there. So I should then clarify, I suppose, what I mean by the interdisciplinary team itself. So we're going to refer to this throughout the training as the IDT because it's just a little simpler. And this is really that vehicle for collaboration and communication. So when we generate ratings as part of a collaborative group with our other IDT members, those ratings, instead of just being a reflection of our point of view and opinion, those ratings should really be a reflection of the general agreement that all of those different team members were able to come to. Now, the important part that we have to clarify then is who should we be including on this team? So we're telling you guys, invite all these other folks in. So who are we actually talking about? Now, I'm sure you've heard us stress in other trainings how important this is to make sure that we are bringing groups of folks together. We're doing this in a collaborative way. So of course, you already know you're going to be a part of it. The child and the family are going to be a part of it. But it doesn't end there, and it shouldn't end there. There are lots of other people that we want to make sure that we're including. So let's start to think about who else should really be included as part of this IDT team. And in order to do that, I'm going to ask you guys to do a little bit of an activity with me, okay? So what I would like you guys to do, and Mary, if you want to switch us over to the next slide so we can see what we're talking about here, that'd be awesome. So here's what I'm going to ask you guys to do. So I would like you all, just on your own for a moment here, try to brainstorm. Who else would we want to include? Who else has important pieces of information and knowledge that would help us to get to a more accurate rating in the CANs? So we've already filled in 2 of these spots here for you. Of course, the child and youth being at the center, person-centered care, as Rachel pointed out. We also put the parent caregiver on the outside there, but we've got a number of other circles here with question marks for lots of other folks that could be included. So go ahead, start generating a list for yourself of who you want to include. And once you think you got a pretty good list, or as folks are already doing, if you want to type it in one at a time, that's cool too. Jump into the chat box and share with us, who do we want to include? And I'll give a moment for some of those answers to come in before we start to look at them. All right. So let's see, Layla coming in with a couple here. We've got our teachers, our school workers, and our case planner. So I cannot stress enough how important it is to include our educational partners. We know our kids spend a lot of time in school, right? So those folks are going to see a lot of different sides of that kid. They're going to see interactions with peers, with adults. They're going to see things like their ability to put up with frustrating tasks and all that sort of stuff. They can really give us a lot of good information towards. So I love that. All right, we've got the primary doctor, so that's awesome too. Let's see, FSC. Charlotte, I'm going to have to ask you, I am blanking on what you might mean by FSC. So if you don't mind jumping in and clarifying that for me, that would be awesome. Let's see, others that haven't come up yet. We've got different types of specialists, social workers, therapists. Absolutely, we want to find out things like what are they working on with that person? What's the progress like? All of that's going to be important. Some different informal supports. Let's see, extended or close family members, really kind of whoever they're telling us is important to include that family. Grandparents, we've got early intervention providers, school supports, SPOA providers. So if you happen to be involved in some of that mental health side of things as well. Let's see, we've got our, just looking for ones that haven't come up. Oh, family service coordinator. That's what it meant. Thank you. I totally could not come up with that one on the fly. Thank you, guys. All right, let's see, any and all providers that are currently involved with the consumer. So another really great point. Anyone that's involved, anyone that has information and knowledge, and anyone our child and family is saying they'd like to be involved in the process, we could probably get them in and get them involved in this process. So now that we know who we want to include, there's another really, really important piece to this, okay? We're not just going to invite people to the table and then not make any use of them once they're there, right? If we're going to invite them in, we want to make sure we're making use of their time. So for those of you guys that jumped into the box and gave us at least one response in terms of who you want to include, now I want you to take it a step further and I want you to think about what areas of the cans, it could be domains, it could be certain items, what areas of the cans would that person be able to provide some information toward? So if you entered a person into the chat box already, that's the person I want you thinking about. If you didn't enter in, steal shamelessly from somebody else and let me know what would that person be able to bring to the table in terms of information related to the cans. Okay, so think about the person that you gave me and then think about what they could bring to the table. And if you could provide both in your answer so I don't have to look back and see what you said the first time, that'd be great. So in other words, if you happen to say something like I don't know, maybe therapist, and then you came back with risk behaviors as the answer, that would be helpful to know both of those so I don't have to navigate through the chat so much. All right. Let's see. So we've got some folks chatting in here. All right. So we've got that we can ask people. So as far as the school and the medical providers, we could be asking them about information from the school, the educational domain, and the medical module. So that was a really great point. We've got things like self-care activities. We might be getting some of that from maybe some of the social workers, therapists that our kiddos are working with. We also might be getting that from things like our parent, caregiver, and child youth as well, right? Let's see. From mental health providers, we might get information about trauma, about the behavioral risk stuff. From school, maybe some of those also. But for school, like you said, Bethany, we're going to mostly focus on maybe some of those academic factors, those things coming up in the academic domain. Teachers could give us school achievement. Also, the peer adult interaction. I love that, Layla, thinking outside of just that school domain. What other areas would teachers be able to give us some insight into? Let's see. Carolyn, shared family members could talk about trauma issues that the child may have. Absolutely. Our family members are a wealth of information, right? They know that kid better than any of the rest of us. So they can definitely provide lots of information into this. Primary doctor might give us things like history stuff that might play in, might give us some of the information around the diagnosis, the medications, testing, all of that really great information to have if we want to make sure we've got accurate ratings in our cans. And then other types of providers could speak towards things like trauma history that they're aware of, some of those risk behaviors and things that come up, the school domain, social behaviors, both peer and adult. So absolutely. So this goes kind of twofold then, right? We want to think about who do we bring in, But we also want to think about what areas of knowledge do I want to ask this person about? And why do we want to do that? Well, the more people we invite in, the longer the conversation might become. And as you guys know, the cans is already fairly long in terms of how many items that we're including in there. So we don't want to necessarily have to ask about every single item to every single person that we're inviting to the table for the conversation. Instead, we want to really pick and choose who are we going to ask for which pieces of information. That way we can save ourselves a little bit of time and energy. All right, so thank you guys so much for participating in that activity. We're going to keep it moving and turn things back over to Mary.
Thanks, Sarah. All right, so during the previous activity, and you all did a really great job, identified many of the people who we'd want to consider involving in the IDT. So let's think next about that collaboration process that the IDT does. So now that we know who to invite and what each person might be able to help out with, what is needed in order to create effective collaboration with the IDT team? We want to operationalize shared decision making. Operationalize is, basically that means just to make it happen, make it real, make it concrete and make it clear to everyone in the moment who's involved. The linchpin, right, when team members are not seeing eye to eye, can be the family's voice. Just like someone said before, a therapist may be able to talk about trauma, but don't forget to get, the youth or the family's perspective. That family voice is the linchpin. That's key. So we start by ensuring the team members recognize that the voice and choice of the child and their support system are of primary importance, right? They're at the center. They're the drivers of the meeting and the assessment process. The care manager may organize the team. That's really a huge part of what you do as care managers, is that organization. But if the child, if they're old enough to, and developmentally advanced enough to do so, and the caregiver, others, they're all equal partners and have shared ownership of that IDT. If the health home care manager doesn't know if it's appropriate for the child to be part of the process, talk to your supervisor, right? Or talk to the child's medical professional or the parent or the child themselves, to make that determination. But this reminds me actually of a saying that I really appreciate, and that is nothing about us without us, right? It's a consumer saying where a family might be, if you're just going to talk about me and I'm not going to be there, it's not going to work. I don't want anything to happen without me, right? Because it's about them, right? Nothing about us without us, right, sir? Okay. All right, the care manager is the person who's the most familiar with the CANS assessment. And you'll want to make sure that you're providing descriptions of the items, if you're doing the CANS that way, where you're naming items and saying this is a CANS item, descriptions that where, some items may be unclear, and potentially giving your own examples of what the ratings or the action levels might look like as they pertain to the child and family you're working with. So individualizing to their story what the action might look like, what what the need or strength looks like for that individual. It'll be important to emphasize transparency during the process, and we want all of the individuals that make up the IDT to feel comfortable with the process and how it'll work and what will happen with the information that is shared. We also want to maintain the forward focus of the conversation or the assessment. If we get too stuck on any one particular item, trying to get to a point where every individual on the IDT agrees with a rating, we will never get through the full assessment with the team, and the people will get burned out. You'll get burned out too. We need to be mindful of how much time we're spending and keep that momentum moving forward. That makes sense to folks? If you have any comments at any time, just chat right in. So let's talk a little bit about consensus. What actually is consensus? We talk about it all the time. We talk about it in the introductory training. Anytime we talk about the CANs, we're talking about consensus and building that. And since the care manager works with the team to develop consensus, it can be important to understand what consensus actually is. Consensus is a general agreement amongst the team, but it does not require 100% agreement by all. That's usually just not even possible. So there may be times when a care manager might arrive at a rating on a CANS New York or develop a component of the plan of care that he or she does not necessarily fully agree with, and that's okay. So, for example, the care manager may desire the team to pursue a more intensive intervention. Maybe they see the action level as higher than some others on the team. But if the youth or family is not ready to take that step, then we need to listen to them, right? This can be challenging work, as you all know. And sometimes it's helpful to keep in mind that our goal is to help the youth and families achieve change, that transformation. And we can achieve the transformation only if the family and the youth is invested in the interventions that we're doing and in that process. It's their journey of care, right? It's important to note that we need to make sure to document lack of consensus, right? People, certain experts or family members, it may be really important for them to make sure that, their opinion on a matter is written down. And, so as the care manager, you may, find yourself needing to do that. Additionally, we might not wait for consensus before acting if there are major safety concerns. So, that kind of goes without saying. If you've got a very risky situation, a dangerous and disabling need, something that's happening that needs to be addressed right away, we might not be able to wait for consensus. But ideally, we do. Right? It's likely that you have experienced challenges in building consensus. Would anybody like to share an example of a time when you helped to work toward a solution on a team where not every member agreed with the plan? Tell us about an example of that and maybe what strategies you used. I'll give you a moment to think, and you can unmute or type in the chat box, whatever your preference is. I'll say it again. An example of a time where you've helped to work toward a solution on a team where not every member agreed with the plan. Doesn't have to be in the care management scenario either. Who has an example? Oh, you've all been on teams that have agreed 100%? I don't know about that.
Mary, I can share an example while folks are thinking about what they might want to put, or if they're typing in.
Right, yeah, I know it takes some thought, right? And actually, Rachel Houghton just mentioned working in the ER, not sure what the patient is presenting with. Right, so not everybody has all the information there in the ER, right? Is how I see that. You have different answers, different maybe diagnoses or thoughts about what to do next. Good example.
So I can think of some times where certainly the teenagers that I worked with and their parent or caregiver were not in agreement about maybe the source or root cause of some of the concerns that we were seeing, right? So there might be disagreement about whether it was something environmental versus something more mental health related versus, and so those sometimes if we can't agree on the cause, it's hard to agree also on what to do about it when we're thinking about action and things like that.
Definitely. And I think we have a few more answers in the chat box. Great. Layla says working in a rehab and different ideas on discharge planning. Absolutely. Those are some big decisions about what happens next, and you're letting your patient or the client go, and they're not going to be in your care anymore. So having that team come to a consensus can be, important and really difficult, right? Erin Wilson, working with a child forming a plan of care. A child had different goals than the parents did. Yeah, absolutely. Especially our teenagers, right? Or our oppositional youth. Family members not valuing education and working toward getting children to go to school. Right? Yeah. I mean, if you've got educators as part of your IDT, they absolutely value the education, and if the family does not, then that's going to create, some disagreements potentially. Good. Anybody else have any ideas? How about strategies that you've used? Strategies that you've used to work toward a solution when people didn't agree on a team? Meeting the member where they're at. Absolutely. Sometimes you just have to, go with where they're at the moment. It's like that motivational interviewing that we do. Getting basic needs met first, right? Being really realistic about the fundamental, essential things that have to happen. Remember, you're all there to support the child and family, and everyone is well-intentioned. Oh, that's a big one, right? That helps with the emotional stress that goes along with that disagreement, right? To just kind of remember, like, everybody here is here because, they have good intentions. Just have different ideas about what should happen, maybe, or what's going on. Okay. Good. All right. Thanks. We're going to talk some more about some strategies and conflict resolution type stuff later on today. But I want to transition to Sarah, who's going to talk a little bit about that process, including recognizing the strengths of the team, that positive focus that Catherine had, that remembering everyone is well-intentioned. Sarah.
All right. So, appropriate time to jump into this conversation since we're talking about some of the conflicts and things that can come up when you are working as part of a team. So the great thing about this whole section is that we can use a lot of these strategies, whether or not we're talking about CANS assessment, or if we're just talking about the work that we do in general, or heck, we're just talking about navigating our social lives and other people as well. Conflict comes up all over the place. So feel free to steal shamelessly from all of us. So when it does come to the CANS assessment piece, I think one of the best things that we can do is to really recognize those strengths of each of our individual team members. And again, what's the reason for gathering a team together? Well, it's because those areas where I might lack information, somebody else might have a wealth of it. And so we want to sort of balance each other out that way. So when we collaborate with others, it's really helpful to know, first of all, about our own area of expertise and where our expertise might be a little lacking, all right? And we want to be honest about that, okay? Something I've had to learn through trainings. People are going to ask questions that I sometimes am just not going to know the answer to. Or they'll use acronyms for a family service coordinator that I won't be able to figure out, right? So there are times we just have to humble ourselves a little bit and realize we don't know everything, and other people might be able to help us out answering some of our questions. So when we think about those areas of expertise that we have, what kind of knowledge do you yourself bring to the table? What are some of your own strengths and talents that help inform some of that knowledge? And what's your professional judgment of whatever the situation is that's being discussed? We also, of course, on the flip side, want to think about what isn't our area of expertise. So if there is an area that I'm unsure about, I want to first acknowledge that. And then I want to problem solve, well, who could bring that information in? If I don't know it, who might know it? Who's the expert? What are their credentials? And what's their professional judgment of the situation, right? And then I also want to make sure that there are ways that I can double check the accuracy of the information that I'm gathering. Another important piece to inviting multiple different members in from that interdisciplinary team is that it's another way to check the accuracy. If I'm hearing the same thing reported from multiple people, chances are it's fairly accurate information that I can rely on. So when we think about the cans, when you guys think about the different items, the different domains that are on there, I want us to give an honest thought to this for a moment. And I'd love to know from you guys, either in the chat box or verbally, what's an area of the cans where you maybe don't have a lot of expertise? And who are those folks that you might be able to reach out to get some of that information? So think about your own process of doing the cans. What are some of those areas, either a domain or maybe a specific item, where you might not have the expertise and you might have to rely on somebody else, and who would that person be? And I'll give a moment for that for you guys to come up with some responses. All right, starting to get some answers in. Thank you guys. You are a very, very participatory group. I love that, especially in only an hour-long training, right? We got to keep it kind of chugging along. All right, so the trauma domain, right? If we're not experts in trauma, we might be able to fall back on maybe our psychiatrists, social workers, parents, therapists, folks like that. Absolutely. Dr. Arabellas came in with my example I was going to go give in case there was a long moment of silence there. The medical module, right? I'm not a nurse. I'm not a doctor. I have no idea when it comes to the medical module, to be quite honest. So I have to rely on the expertise of other folks, such as, say, that primary care physician. Again, things like psychiatrists. Those are some of my folks I might be looking a little bit more towards for some of the medical piece. And then Bethany added in, again, some of our trauma symptoms. So not necessarily that ACEs domain, but some of the like trauma response type stuff that we're thinking about might be best to reach out to maybe a therapist or a psychiatrist. So again, that's totally okay if we don't have all of the knowledge that we need to go through that entire CANS. Most of us don't have the background to be able to do that. So it's about pulling your members together as part of this IDT in a sort of a mindful way to be able to really gather all of the different pieces of information we need to complete this document. All right, so now let's talk a little bit about the actual resolution of conflict here. And I know people hate to hear this, but to be quite honest, the first step to resolving conflict is to admit that it exists, right? It's sort of like when you've got some sort of a substance use issue, right? That first step, you got to admit there's a problem. So the first thing we have to do to resolve a conflict is admit that it's there, right? There is a conflict and it needs to be resolved in some sort of a way. We also just want to accept the fact that conflict is a normal part of collaborating. If we were collaborating and there was no conflict that ever came up at all, that would make me really question the folks that we're bringing to the table, right? That sounds like we've got a lot of really homogenous folks that all think in the same way, not necessarily the best way to go. So conflict is inevitable. It's going to happen when we get multiple people together and we try to get them to agree on something. Conflict is also really helpful because it's kind of like a fire alarm going off, right? It's a signal that something's wrong and something needs to change. So it's not inherently a bad thing. It's sort of a cue to us that whatever we're doing right now, not really working too well. We might want to shift our strategy a little bit. Conflict also, of course, can result in a learning experience. And if we can learn from it, that can also lead to a lot more productive outcomes. If we think about the resolution of conflict in these types of IDT treatment meetings, right? By role modeling conflict resolution, we're actually working on some skill building there for a child and even the family as well, potentially, right? Them being able to take some of those conflict resolution skills forward with them and be able to use them successfully on their own later. Being able to resolve conflict can also help us build upon existing professional relationships. If I have a conflict with, let's say, somebody that I'm working with, either someone, maybe a service provider, or maybe the child and family themselves, by showing them that we can have a disagreement, right? A difference of opinion, as it were, and we can work through that and get to a resolution, that's also helping to actually strengthen that relationship that I've got with that person. And lastly, it can, of course, help us to make better future decisions. If this results in a learning experience, then hopefully we learn from it and we're able to make decisions a little bit differently in the future. So the key of all of this is not actually to avoid conflict. It is unavoidable, and it is at times actually very healthy. So instead, we want to learn, how do we resolve it in a way that is healthy and productive? The other thing we want to remember about conflict resolution, and sometimes this is hard for us to digest because we're helpers, we like to problem solve. So sometimes the other thing we have to remember, conflict is not a math problem. There's not always a set solution, right? Sometimes there's no solution at all. Sometimes there's many more than one possible solutions, and we're trying to narrow it down and decide between a few options. But we have to admit that sometimes there's just not that, glowing, correct resolution to whatever that conflict is, and that's totally okay. All right, so continuing forward then, how do we actually do this whole resolution thing? So we do have some skills up our sleeve, and in a moment, we're gonna give you guys a bit of a case vignette, and we're gonna ask you to think about, how can we make use of some of these skills and strategies that we're talking about? So the first thing that can be helpful to do when you've got conflict happening within that team is to try to really take on or understand the viewpoint of all of the other folks that are involved in that conflict. So that ability to stand in someone else's shoes, to empathetically, right, understand what's going on for those other folks. If we can understand why somebody has the opinion or the feeling that they have, it can help us go a long way in helping them sometimes to even explain that to the other person that they're in that conflict with. Another strategy is to be able to respond in a calm, non-defensive, and respectful way. Remember role modeling, right? We're not trying to teach conflict resolution that sounds very loud or very angry with lots of shouting and profanities and all sorts of that fun stuff, right? We're trying to teach conflict resolution in a way that says, hey, it is possible for people to disagree and to work through that in a healthy and productive way. So we are role modeling that calm, non-defensive, respectful way. And I think going along with the non-defensive is that empathy. The more we can take on the understanding of the other person, the less likely we are to be super defensive about our own position or opinion on the matter. We also want to look for some of those creative, person-centered solutions. So the fact of the matter is, again, sometimes our problems have multiple possible resolutions or solutions that can be applied to them. We want to brainstorm and consider as many of those as we can so that we have a better chance of helping our child, our family, to be able to really get to one that everybody can kind of agree on, looking for a little bit of that compromise. The next piece is that willingness to really confront conflict head on. Now, when we say that, that does not mean that we're confronting the person head on. That is likely to lead that person into a very defensive type position, right? So it's not about confronting the person, but instead it's about confronting or attacking the argument. And that might sound a little bit like splitting hairs, but if we really think about it, there are times where we're arguing with people and we get angry and we start to say things about the person as opposed to about the conflict or the problem that's actually happening. And so we want to be very careful, again, role modeling, right? To attack or confront the argument the person is making, right? Possibly maybe the logic of the argument, but not the person themselves. So very, very important. And then the last piece is really an openness to move forward and a willingness to agree on compromise, okay? Sometimes that's also something that we have to talk to our other team members about, right? Going into the assessment process, I often like to preset people to the idea that we're not necessarily going to 100% agree on every single item, but we will look for ways to at least get to a compromise, and we'll look to get to a point where everybody can at least understand why we're deciding what we're deciding. Like Mary said earlier, we're not always going to get everybody to necessarily 100% agree with each other, and that's okay, right? We don't necessarily need that. We just need folks to really have an understanding of why or how we got to the place that we got to in terms of that resolution or that solution. Any questions, comments from anybody on these types of strategies for resolving conflicts? Or does anybody have any fun ones that they've tried out themselves that have worked before? Any additional strategies that tend to work fairly well for resolving conflict? All right, so we are going to keep moving forward then, but if you are partway through typing your answer into that chat box, I know it takes a while, don't panic and hit delete. As soon as I see it come in there, we'll make sure to chat about it. So here's what we're going to do. We have 15 minutes left, and we are going to get you guys into some breakout rooms in a moment, and we are going to do a little bit of an activity with you. So we want to take some of the things that we've talked about so far during this lunch and learn, and we want to actually practice applying them, because we know that's the best way for people to really work on learning this stuff and getting good at it. So here's what we're going to do. We're going to read a vignette together. Then we're going to look at 3 questions. We're going to break you guys into some breakout rooms. I would like you as a group to answer those questions, and then we will pull everybody back in for the last couple of minutes to discuss what the groups came up with. So let's first start by looking at our vignette. So Gina, who is 19 years old, recently moved back home with her parents after living independently since graduating from high school. The IDT team meeting consists of Gina, her mother, Carmen, you, the case manager, and Gina's therapist. Gina starts this meeting and she says that she is interested in taking classes at a local community college. She is not currently working. Next, Carmen accuses Gina of stealing her grandmother's opiate medication, and an argument erupts. Gina shuts down after refusing to answer her mother's questions about stealing the medication. Yesterday, her therapist informed you that Gina had admitted to taking the drugs and may be open to substance use treatment. The therapist cannot reveal this to mom because of privacy laws, and you are updating the CANS New York, and the only item left that needs to be rated, of course, is substance use. Carmen insists her daughter has a drug problem. Gina is silent, and the therapist has stopped trying to get Gina to talk. The team is at a stalemate, and you need to finalize the CANS New York today. So again, we're going to look at the questions that you guys as a group are going to chat about. So Mary, if you can move us forward one more slide here. So the first question is, and you can answer these in any order really, but what is the conflicting information that we're getting from Carmen, from Gina, and from the therapist? What is the conflict here? Once we identify what the conflict is, how should the team decide whether or not that substance use need is actionable? So here's the thing. We're not looking for you guys to come up with a rating here, right? That we would do with the help of Gina and Carmen and so on. What we're looking for is you guys to brainstorm some of the conflict resolution strategies. What might you as the case manager do next to get this team to some sort of an agreement or a resolution here? And then I want you to consider, what is your role as a part of this process? So that's what I want you guys discussing in your groups. We're going to break you into the groups. We're going to give you all of about 5 minutes to have this discussion, and then we will bring you right back in. Mary, are we set to get those groups going?
I am going to just take a minute, but I also want folks to, because I realized we won't have in our groups, we won't have these 3 questions available anymore. So I want folks to sort of take note of what those questions are so that you're prepared to answer them. All right. All right.
Okay.
Basics, right?
Welcome back, everybody. All right, so let's discuss what you guys discussed. So feel free, jump into the chat box, or if you would prefer, of course, again, you can always unmute yourselves. What did you guys discuss? What did you come up with in terms of maybe some potential strategies for how the case manager can move this discussion forward?
So my group decided that because the parent is angry, maybe we can offer the parent a chance to take a walk or get something to drink or to be able to cool down and not be so angry. And while that is happening, since we know that the child is open for treatment, she might be open to talking to me about it and getting her to be able to be comfortable and talk to me about it. Then once the parent comes back, if she wants to talk about it, then we can go ahead and proceed that way.
I love that idea, Rachel, the old divide and conquer, right? So get mom out of there to get a little, a little deep breathing in or whatever, calm some of the emotions down, because we know this kid has already admitted to at least one person. She's mentioned that idea of substance use, but clearly mom's response is potentially causing her to not want to acknowledge that to mom right now, possibly because of that anger response she's getting. So I love that idea. While mom's out cooling her heels a little bit, we're going to chat with Gina herself and try to get a little better of a perspective of what's going on, and maybe chat with her about what will we discuss when mom comes back, right? What will that conversation sort of look like? So I love that idea. Let's see, in the chat box, we got meeting with the child alone and then aid her in opening up more, identifying the substance abuse is related to, identify if the substance abuse is related to maybe something like a suicide attempt. So again, sort of that strategy of thinking about, while these two are together, this might not be working so well. If I can get them a little one-to-one time, right? Maybe that'll give us a better opportunity to get to some of that information with them. So again, not a bad strategy, not a bad suggestion there.
Right. As long as after you divide, you bring everyone back together for that consensus building.
Divide, conquer, and reconvene. We should change that phrasing, right?
Right.
All right. What else did your groups discuss in terms of a potential strategy for moving this conversation forward with Gina, her mom, and the therapist in this case? Guys, when you all share at once, it's too hard for me to keep up with it. How about at least one more potential strategy? How can we possibly move this conversation forward? We've got mom and Gina. They're butting heads over this substance use issue. What do you guys think? Okay, another group had the same thing. We got a lot of like-minded folks in the room with us today. All right, so again, a little bit of dividing and conquering. And some of that, again, that might make a lot of sense knowing that we've already had Gina open up in a space where she felt comfortable. She had some of that individual time. So I think it is a good strategy to be thinking about what already worked and how do I maybe keep that moving forward a little bit. Lauren sharing a similar thing, speaking to her alone, building that rapport, building that trust.
And also she has the relationship with the therapist too. So the therapist being a member of the team, she has that relationship and could potentially facilitate the IDT conversation.
Great point.
All
Yeah,
right.
thinking about our expertise in our team, make use of that therapist and her relationship. All right, Mary, wrap it up for us.
Sure. All right. So this is just a quick reminder of our institute, the resources that we offer, and the different people. If you want anybody's individual contact information, you can also chat in, and we'll get it to you. Thank you so much for your time.